You're looking at the first batch of medical supplies that Canada's sending to India. That country battling surging cases of COVID with at least 3,000 deaths a day. Could be way more than that, though. Today, the Canadian Armed Forces deployed an aircraft delivering vials of the antiviral remdesivir and 50 ventilators. International aid has been flowing into the country for days now, but will it actually be enough to improve the situation on the ground? Aditya Raj Kaul is a journalist and a contributing editor with CNN News 18, and he is with us from New Delhi. Aditya, I want to thank you for joining us to talk about what is an utter catastrophe unfolding in your country. But I understand that some Indian states have gone into lockdown in an effort to try to control the explosive growth. But there are calls for the entire nation to go into lockdown. I know the Prime Minister sort of resisted that route so far. Any change, any news on that front?
Well, it doesn't seem like. You're right that the trauma really continues on the streets of the national capital, New Delhi, the Delhi NCR region, and also the entire country. But David, the Prime Minister and the government has been saying that there were economic losses last year. There was a complete economic meltdown because of the lockdown, and that led to a crisis-like situation in the country. And necessarily a lockdown may not help. That's their version. And that's why it's given it to the state governments to decide that if you think that lockdown is a solution, keep that as a very last option. And as of now, yes, in New Delhi, there's a lockdown for last 2 weeks that has been extended. In the state of Maharashtra, where several thousand cases are coming, close to more than 60,000 for several days, again, there's a lockdown. And in several other states like Jammu and Kashmir, Punjab, in the south of India as well, there are several restrictions that are in place. There cannot be a crowd. There cannot be a public meeting. Marriages. But is this enough is the question. There's been a lot of criticism of how there were elections in the past in 5 states and union territories. Also religious ceremony where lakhs of devotees participated very close to Delhi. Apart from that, the IPL, the Indian Premier League, the cricket tournament was suspended only yesterday. So what was the government or the governing body of the IPL really waiting for? So these are mistakes that, lessons need to be learned, but need to be learned quick. Because as of now, the crisis that is unfolding is only getting bigger.
Absolutely.
Is that there are 400,000 cases coming again, and the latest picture is very grim. The death numbers are not coming down. And
Aditya, I did want to ask you, because you talk about 400,000 cases today alone, and that follows on multiple days just like that. But the true number, of course, could be, by some estimates, 10 times that. The level of death happening in hospitals, outside hospitals, even in the streets sometimes is horrifying. In the face of this, some countries are coming to offer help. Canada, there's a plane en route now. 50 ventilators, 4,000 courses of remdesivir, this sort of experimental treatment. It doesn't seem like a huge amount. When you hear numbers like that, how far do you think it will go to face against the enormous tragedy that's now unfolding?
Well, David, every drop in the ocean helps. And I wouldn't say that it's not going to help. It's going to help immensely. And Canada has announced this, and this is under process right now. In a few hours from now, perhaps it will be landing in New Delhi. There has been similar international aid coming in from the United States, from UK, from Australia. Was the European Union committing 2.2 million euros for the WHO's assistance to India. And that's primarily entirely for India as an emergency response. We also have other 40 nations coming in from the Middle East and across the globe and shipping it with ventilators, with oxygen concentrators and other medicines as well. So this is going to help immensely, but this is certainly not going to change things overnight because the numbers are huge and the magnitude of the problem is massive. There are mainly beds, oxygen concentrators and cylinders, and medicines that are in short supply, in scarcity. And that's why, as of now, a lot of international aid has arrived, and that's being distributed now through the Indian Air Force, through the Indian Army, and other forces to different states of India equitably.
What about vaccines? What about vaccines, Aditya? I understand that, of course, COVID or COVAX, Russia's Sputnik, they're in use in India, but Pfizer, Johnson & Johnson, and Moderna, not yet being used there. There's been an invitation to sell them into the country. Where do things stand?
Unfortunately, not yet. As you said, only Oxford AstraZeneca, which is of course produced by the largest manufacturer of vaccines in the world, Serum Institute of India in Pune, Maharashtra, and the Covaxin, the indigenously built by the Bharat Biotech. And now the initial consignment of Sputnik from Russia has arrived as well and will be rolling out shortly. But the growing criticism is also of how this second phase of vaccination has not really been on a massive scale. I, for instance, have registered for it, but haven't been able to get a slot. Now, is this because the vaccines are in short supply, or is there a huge crowd already waiting?
Yes.
Well, that's everybody's guess.
Yeah.
That it is certainly in short supply. Adar Poonawala, who's the head of the Serum Institute of India, has said that there is a lot of raw material that is required. And that's why this morning, US President Joe Biden, answering reporters, did say that he will do whatever is possible. And he is committed to Indian Prime Minister Modi that the raw material from US, the filters, will be certainly provided and the vaccines will increase. Canada, of course, will be getting that share from the US as well. But it is certainly a nightmarish situation right now. One, tackling the health emergency and the scarcity of resources. Secondly, the vaccination drive that needs to be much, much bigger.
Aditya, I want to ask you, I've only got a moment here before I go, but you have been involved at sort of the big level, trying to track where things are needed, oxygen tanks going to people who need them. You have admitted your own uncle to the hospital. Can I just ask how he is doing? I understand he has COVID.
He has COVID. He has COVID for the last 15 days. He's 74. He's been in the security apparatus of the country many years back. He retired in 2007. And as of now, he's in the paramilitary hospital just on the outskirts of Delhi in Greater Noida. He's responding well, but unfortunately, he's still on oxygen. I spoke to him earlier, and his spirits are very high. But, you know, as I say always, there are thousands of such people who are not even getting bed. I'm lucky. I'm lucky that my uncle could get bed. I will leave you with this. There was a 26-year-old girl in the city of Bangalore. His attendants called me early in the morning at 4 a.m. today and said her saturation had dropped to 55 and she wanted a ventilator. She couldn't get a ventilator. 15 of us tried our level best to get a ventilator and oxygen bed. Unfortunately, she passed away outside a hospital
outside
in Bangalore. Such are the grim scenes. She couldn't find a bed. And the hospital was completely helpless. Now, I'm telling you one story. There are thousands of such stories, not just in the national capital, but all across the country. Just imagine what we are tackling with.
Absolutely. Aditya, thank you so much for speaking to us. Best of luck to you and to your family to get the help that unfortunately is so needed right now.
Thank you so much, David. Stay safe.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.